stroke is broadly divided into two major categories: ischemic stroke and hemorrhagic stroke. Ischemic strokes account for approximately 85% of all strokes, while hemorrhagic strokes make up about 15%. Let's start with ischemic stroke. Ischemic strokes occur when blood flow to the brain is blocked. There are three main subtypes: thrombotic, embolic, and lacunar strokes. Thrombotic stroke involves large vessels. The mechanism is atherosclerosis leading to plaque rupture, which then forms a thrombus that blocks blood flow. The most commonly affected locations include the internal carotid artery, middle cerebral artery, and basilar artery. The main risk factors are hypertension, diabetes mellitus, hyperlipidemia, smoking, advanced age, male sex, and family history. A characteristic feature of thrombotic stroke is stuttering progression, and these strokes may occur during sleep. When embolus sources from heart, it is called cardioembolic stroke. The mechanism involves a clot forming in the heart that travels to the brain. The most common cardiac source is atrial fibrillation. Other sources include valvular disease, such as mitral stenosis, recent myocardial infarction, and infective endocarditis. Risk factors include cardiac arrhythmias, particularly atrial fibrillation, structural heart disease, recent cardiac procedures, and hypercoagulable states. The key clinical feature is sudden onset with maximal deficit right at onset. Lacunar stroke affects small vessels. This occurs due to occlusion of small penetrating arteries caused by a process called lipohyalinosis. These infarcts are small, less than 15 millimeters in size. Common locations include the basal ganglia, internal capsule, thalamus, and pons. The most important risk factor is chronic hypertension, followed by diabetes mellitus, age, and smoking. Lacunar strokes present with classic syndromes like Pugh motor or Pugh sensor deficits, and importantly, there are no critical signs. Now let's move on hemorrhagic stroke, which accounts for 50% of all strokes. Hemorrhagic strokes are divided into intracerebral hemorrhage and extracerebral hemorrhage. In the CT scan, you can see intracerebral hemorrhage with bleeding directly into the parenchyma. The most common location is the basal ganglia, as shown here, followed by the thalamus, pons, cerebellum, and subcortical white matter. The most important risk factor is uncontrolled hypertension. Other risk factors include cerebral amyloid angiopathy in elderly patients, anticoagulation therapy, thrombolytic therapy, vascular malformations, tumors, and coagulopathies. The typical presentation includes sudden severe headache, nausea and vomiting, and rapid deterioration of level of consciousness. As you see in this image, subarachnoid hemorrhage involves bleeding into the subarachnoid space, most commonly caused by aneurysm rupture. Risk factors include smoking, hypertension, alcohol abuse, family history, polycystic kidney disease, and connective tissue disorders. Patients typically present with sudden severe headache, often described as the worst headache of their life, along with nausea and meningeal signs such as neck stiffness. Here we see subdural hemorrhage, which occurs between the dura and arachnoid mater. It's caused by tearing of bridging veins. Risk factors include head trauma, elderly patients due to brain atrophy, anticoagulation therapy, alcohol abuse, and falls. The presentation is typically delayed or gradual, especially in chronic subdural hemorrhage, with symptoms like headache and cognitive decline developing over time. Finally, we can see epidural hemorrhage occurring between the skull and dura. It's caused by rupture of the middle meningeal artery. The main risk factors are head trauma and a skull fracture, particularly of the temporal bone, and is more common in young patients. In CT scan, we see the characteristic lens-shaped or biconvex appearance. This means the patient may initially appear fine after the trauma, then suddenly worsen. Thank you for watching. You can visit our website for quizzes and mind maps like this.